one is so that's the first question. So the second question, so give the correct symbol for lung meridian. I think majority of you answered correctly. It is LU. That is very simple. And similarly, large intestine is LI. So that is also very simple. So stomach also, I think majority of you given ST. So I think these are all correct. Urinary bladder, I think there is a mistake here. I think I have not given the correct this thing. Sorry. I think I'm looking at quiz 2, right? One second. Sashiji, this is where you were pointing out some issue, right? Okay.
Yeah.
Question. Okay. I got it, Sashiji. Okay. Yeah, sorry. So I think the first set of questions are pretty simple, except for that SJ and TP. I think some of you have got confused. Otherwise, majority, I think you are given correctly. And then the next question is, select all the meridians whose organs are not considered as an organ as per allopathy. I think so this is something we discussed earlier also, right? So these two organs, that is Sangio or triple armor and pericardium, are not considered as an organ. See, pericardium is just a tissue covering the heart as per allopathy, whereas in acupuncture it is called as a separate organ. Similarly, Sangio triple armor, this is not an organ in it's not a one single organ, because it talks about three different levels, like lower cavity, upper middle cavity, and upper cavity. So the entire three cavity is like group of organs. So these organs together is called Sangio. So that's why it is called Sangio, which means three. So this, I think some of you have got confused, I think. And then liver symbol, I think everybody had given correctly. This question, I think, sorry, there was a mistake. Thanks to Sashiji and a few others to point out this thing. So it should all start with LU and LI. So I think a majority of the people have put none of the above. Actually, I meant to say that it is LU, LI, but somehow this became wrong. So this is the correct order. The second order is correct. I think there is a confusion here. So sorry for that. And then the next question is, which meridian refers to more than one organ or group of organ? That is Sangio. Like just now we discussed, right? Sangio means three organs, three group of organs, right? Three set of organs. Sorry, it's three group of organs. Then the number of meridians as per modern acupuncture, this thing, it is 14. I think some of you have selected 12. See, we discussed this in the first class also, that 12 is not the correct answer, because 12 correspond to 12 organs. Whereas the two other organs, like root, Ren channel and Du channel, they are also considered as an organ in the modern acupuncture. So these are 14 organs, not 12 organs. I think some of you have selected 12 organs, which is not correct. Then the other question was, where does generally acupuncture points exist? So I think majority of you have selected correctly. I think only one person has said like joints between the bones. That is not correct. It is there in all the places. Points are there in all the places. Then which point is in crease? I think some of you got confused. So LI4, see, I'll just repeat here again. LI4 is this. It is just between your thumb and index finger, whereas LI11 is here. So LI4 and LI11. Okay. I think some of you had selected LI4 instead of LI11. Then, so this table, I think majority of you got correct. So Zhang organs and Yin are related to each other, and Fu organs or Yang are related to each other. Right? I think this also majority are given correctly. I think maybe one or two have got confused. Then similarly, it's the reverse of the same thing. I just given in another order so that you can just repeat again. Then this also, I think some of you are given correct. Some of you, I don't know why you are not selected other things. So see, remembering the order of meridian helps in all of these things. You can you can remember the organ clock, because you see the organ clocks in the same order, right? And similarly, you can identify Zhang Fu organs. So all these organs are aligned as per that order. So remembering that order is very important. And this also, I think, everybody has given correctly except for one person. So Zhang organ means they are solid organs, whereas Fu organs are hollow organs. So this also, I think, all of you got it correct. And Zhang organ again, some of you here, I think you got confused. So Zhang organs are not used for transport of substances. Zhang organs are using storage of substances, whereas the Fu organs are used for transport. So just go through the slide. We'll go through it today also. So Zhang and Fu, we have to be clear. And so this also, I think, majority of you have selected correctly. So I will not go through because these are pretty complex. But if you have seen my PPT, I think you would follow from here. And similarly, this organ clock also, I think majority of you have given correct. Like here we have got 9 correct answers. Here also we got 5 correct answers. See, one thing that this organ clock is a bit difficult to remember. So there is no need to memorize anything here. But still, if you want to memorize, there is a technique which we will discuss in the class today. So I think majority of you are given correct. So there is no problem here. Similarly, lung channel, it starts from chest. So it starts from here. So you can see, it starts from this place, lung channel. And similarly, the large intestine channel, that starts from the forefinger. And then, stomach channel starts from eye, below eye. And then similarly, you have the spleen channel that starts from the big toe. I think all of you have given it correctly. So then the next question is, which channels are yin in nature? So I think this also, I think, majority of you have given correctly. So both lung and SPR. See, that's why that order is there. Lung, large intestine, that order we discussed, right? So that helps you to identify the yin and yang channels. Which channel has 67 thing? I think this also everybody has given correctly. I think quiz 2 also, I don't think it was very difficult, I think, right? I don't know if you had any specific. Sorry, Sashish, you have mentioned about one more problem, right? Sorry, I forgot about that, Sashish.
Yeah, where we have to mention this time clock question.
Okay. Okay.
Like in that, certain things are wrong and we need not to answer anything about it. But then
Oh,
it says that you cannot submit it without answering every line. So that
okay.
was so
Sorry, Sashish.
some wrong entries had to be given in that case.
Oh, okay, okay, okay. Sorry about that. Yeah. So, uh, 1 second, just 1 second. Fine, Saji. So I think still some more people have to take the test, I think. So I will recorrect this, and I'll resubmit it. Uh, okay, I think majority, see, the whole idea of this quiz was just to make sure that you revise whatever we have gone through in the class. So I think that also seemed to be perfect. I think majority of you answered very good. So okay, so let's quickly summarize the important points in the class what we discussed. So I will not go again starting from beginning, because that will be kind of boring as well as too time consuming. I will cover only important points. So first is there are 12 channels. So we all know that what are those 12 channels. So it starts with lung, large intestine in the same order, and each of the channels have different symbols. So only thing that we need to remember is triple armor and Sanjio has two symbols. So Sanjio is the Chinese name, whereas the triple armor is the English name. So it has two symbols, SJ and TP. And similarly, urinary bladder also has two names. So for example, in some places they would have put BL, that is the old standard, but as per the WHO standard, it's always only UB. So these are all the 12 channels, and remember that each of the channels correspond to one organ. Okay, and totally there are 24 channels are there, because there are 12 channels on left and 12 channels on the right hand side. So these are all the 12 channels. Then the important thing that we discussed, we'll again go through. Sorry, somebody is saying something. Okay, I'll mute everybody. If you want, you can just unmute and talk. So the next thing is, oh, sorry, I'm not projecting my this thing. 1 second. So yeah, so there is a small difference between the TCM anatomy versus allopathy anatomy. So as per TCM anatomy, pericardium is an organ, whereas as per the English anatomy or the allopathy anatomy, pericardium is just a muscle, right, which is wrapping on the heart. Similarly, Sangio is actually is something unique for TCM Chinese medicine, because that covers three cavity: upper cavity, lower cavity, and middle cavity. So these are all the cavities where the heat is generated. For example, when we eat food, the carbohydrate is burnt and then heat is generated. Similarly, lung, see, every organ has to maintain that heat. Otherwise our body will get into multiple problems. Similarly, when you have a fever, basically, let's say there are some toxins or virus or bacteria. The way body fights is it increases the temperature. So this is one reason why we should not take paracetamol, because paracetamol and other medicines, they try to bring down the body temperature. So then it takes more time to recover. If you don't take these kind of medicines and keep the body temperature as it is, within 1 or 2 days you can recover very fast. I'm not encouraging or discouraging you to take any medicine. That's a different story. Then the next important thing that we discussed is, this meridians we already discussed. There are 12 meridians and 24 meridians on both the sides. And where do these meridians, where do these points? So there are acupoints on each of these meridian. So the number of points, all these things, is there in the PPT. So where do these points exist? These points exist at the crease. So crease is like when you fold two parts. Like for example, I have a thumb and I have this thing. When I fold them, there is a small line that you can see, right? So many places on the joints, when you fold, there is a crease. So the points are there at the crease or end of the crease. So one example is LI11, right? LI11 is here. Then those are in the joints. There are many joints are there. So between those joints also there. For example, you have this joint, right? So here there are many points are there. So very important points are here. Similarly, here also there are important points are there. See, by now right? There are three channels that flow here, right? Heart, pericardium. So all these channels, if you see lung, heart, pericardium, all these channels have important points here. You can see many important points are there. Then the points are there between bones also, wherever there are bones. For example, on the spine we discussed, right? Between each and every, see, you have three parts in the spine, right? Spine is composed of three parts, like cervical, those kind of things. So in each of the sections, there are small bones are there. So between those two bones, you have this thing like lumbar region bones. There are some points are there. Cervical is there. Thoracic, there are thing are there. So these points are there. Then the next one is in depressions, right? For example, so if you take here, right, there are some depressions are there. Similarly, here also there is a depression, right? So in these depressions, so here also there is a depression. So the points are there in the depression. Then the next thing is what we discussed is that the organs are classified into Zhang and Fu organs, right? So there are few things that we need to remember, that whatever the organs we discussed, it has to be remembered in the same order. The reason why it has to be remembered in the same order, because when you when you want to learn certain things like see, we'll see this in the next classes how to diagnose. So Zhang Fu organs, these organs are in some particular order. Similarly, there is something called organ clock theory. Then how to memorize the flow of meridians. All these things, the orders, there are certain orders. So if you remember the same order like lung, large intestine, that order, then it becomes important. That's why you have to remember this order. Okay. Then the next thing that we saw was, so what is yin and yang? Yin and yang are nothing but two opposite forces, right? So these two opposite forces are making us active all the time, and whenever there is an imbalance in these opposite forces, then we fall sick. So, for example, so these forces can be thought like male and female forces. So it doesn't correspond to a male person and a female person. Okay, so don't think that way. It's like attributes of or characteristics of a male or female. We can think about it. So, for example, males have some characteristics. That doesn't mean males have only those characteristics. They also have a female characteristics, and vice versa, right? Similarly, these characteristics. What are these characteristics? In stands for negative polarity, right? And it is passive in nature, and it corresponds to left, right? And similarly, yang is positive, active. See, yang is like if yin energy is more, then you always tend to sleep. You tend to so yin energy, when it will be more in the night, yin energy will be more, right? Because that's the time when we have to take rest. Whereas yang energy will be more in the this thing, and these energy keep alternating. And similarly, organs also they are classified into two types, like Zhang organs and Fu organs. So Zhang organs correspond to yin channels, right? And Fu organs correspond to yang. See, yin and yang corresponds to channel and two side of energies, whereas Zhang and Fu corresponds to the organs. So these Zhang organs are solid in nature. So, for example, you can take organs like spleen, lung, kidney, liver, heart. These are all like solid organs, right? So these are solid organs, and they don't actually transport anything. Correct? They store, for example, in lung we store oxygen, right? And then it is the blood vessels absorb the oxygen. Similarly, kidney, it stores. So liver stores fat. So these are all storages, right? So these are all storages. Zhang organs are storages, whereas Fu organs, these are these are hollow in nature, so they are not solid organs. So the examples are like you can think of stomach, right? Stomach is hollow, right? Food has to pass through. So basically, the Fu organs transport the energy, whereas substances, and then it acts as a source for this thing, transportation. Whereas the Zhang organs are actually storing the substances, and then it acts as a vital source for energy. So that's the difference between these two. So so this is about yin and yang. Then the next thing we discussed is about the meridians. So how the meridians are located, right? So like we discussed earlier, there are meridians are of two types. One is yin and another is yang, right? So totally out of 12, 6 are yin, 6 are yang. Okay, and 6 stands. 6 are starting. 6 are connected to limb, 6 are connected to hand, right? So how they are connected, this I think we discussed, but I'll repeat again here. So for example, there are 3 channels which are starting from arm, right? They start from arm. Sorry, they are they are connected to arm. So they start from chest and then they connect to the hand, right? So for example, lung channel, right? Then heart channel. So these channels are starting from here, right? So it starts from here and then it connects here. So 3 channels which starts from chest to hand. And from the hand, there are other 3 channels which start from hand, especially from the nails, right? And these are yang in nature. And where do they end? They end in the head actually. Head means not in the head exactly, somewhere else, right? And then from there again, 3 channels start from head and then it goes to the toes, right? And from toes again they start and then come back to the chest, right? It's like a circular this thing, okay? So then I think I posted about 2 apps in in Google Classroom. So out of which one app gives you a complete list of all the organs. So you can refer to that app. If you don't have the app link, please go to Google Classroom and then you can take it from there, right? So it talks about all these channels. Then the next thing what we discussed is about the organ clock theory. So what is organ clock theory? Organ clock theory says that the energy flows through all the organs, but the way it flows through is that each and every organ gets the maximum energy at some point of time, right? So for example, the way to remember this, you can think about a simple technique, right? So for example, like you can start with, let's say, 3 o'clock in the morning. Okay, so when you start at 3 o'clock in the morning, the first thing is that our lung becomes active, right? So the lung is actually trying to rejuvenate itself, trying to get fresh air. So 3 to 5 is the lung time. Then after 3 to 5, you can think of 6 to 7. 6 to 7 is the time where we pass stool, right? So that is the time for large intestine, because large intestine is the responsible for eliminating waste, right? So stool. So that is the time. So 3 to 5 is lung, 5 to 7 is large intestine. Very easy to remember, right? And then after that, 7 to 9 is the time where we eat breakfast, right? So that's the time when stomach is actually active. And then 9 to 11, spleen is active. So spleen is, as per Chinese acupuncture or Chinese medicine, spleen carries the prana to every place, right? So the spleen becomes active, so that it starts doing this. Then between 11 to 1, we get more energy on the heart, right? Because the blood has to be pumped all over this thing, right? And then from 1 to 3, the small intestine works, because by this time the digestion has happened. Because see, when you eat, let's say at 7 o'clock or something, by 12 or 12:30, the digestion would have been completed. and then the small intestine is active, and small intestine gets maximum energy. What is the job of small intestine? It is to absorb all the nutrition from the food. Actually, once it absorbs all the nutrition from the food, then the wastage is sent to the large intestine as a stool. Then you have bladder, urinary bladder. Urinary bladder separates this thing, right? It stores the urine and separates all. And then you can think of kidney, which is active from 5 to 7, right? So kidney is also very important, right? It does a lot of other nutrition related activity. And then you can imagine, like after 7, the sunset happens, and then the temperature becomes cold, right? So then the body starts warming itself. So first it focuses on the pericardium. Like pericardium gets maximum energy, so that between 7 to 9 the pericardium starts, and then the triple warmer starts. Where the triple warmer, what it does, it focus on energy, so that the entire body temperature is maintained. And in the night, between 11 to 1 a.m., your gallbladder is getting the maximum energy, so that your gallbladder is cleaned, and then it is ready for the next day digestion, right? And 1 a.m. to 3 a.m., the liver is active. So liver also is active during that time. So you can imagine, like between 11 to 1, gallbladder is active, and 1 to 3, liver is active. So this is the period where you need to get a good sleep, so that your body completely rejuvenate itself, right? If during this time, if you don't get a good sleep, or or you don't sleep, then next day morning when you wake up, you get a problem, correct? So it's very easy. You can remember the organ clock theory. It's not a big complex thing. And the next thing what we discussed about is, once again, about what all the this order we already discussed, but anyway I'll go through. So you have 12 channels, and these channels start from where to where we discussed in the last class. And the direction also I given, you can see here, right? I highlighted in 3 different colors. So first set is one pair, where it starts from chest to hand, right? And then hand to head, and then head to foot, and then foot to chest. So it completes one cycle, you can imagine like that. And I have given it in yellow color. And the polarity, if you see, it is yin, yang, yang, yin. See, first is yin, but after that you see all are coming in pairs, like yang, yin, like that. So you can easily remember. If you remember this table, everything can be easily remembered. There is no big problem. And I given the exact destination where it ends also, right? And each of these points we have discussed. How many points are there? For example, if you see lung, heart, pericardium, all 3 are yin channels, right? And we also discussed what is yin channel. Yin channel means it flows inside, right? Whereas yang channel means it flows outside. So that's why if you see all the 3 channels, that is lung, heart, and pericardium, all flow inside here, right? It all starts from somewhere here and then flows. So similarly, you can categorize and learn. That way, it will be easy for you to remember. Otherwise, if you try to remember all these things, it is going to be very difficult. And another thing that we discussed is you don't need to remember the points. Okay, this is very important. If you want, you can try. I know I don't have any objection, but it is not required or necessary, because I already given you the app, which has all the points. You can refer to the app. Then we talked about what are the different types of points, right? So these are all the very important thing we discussed. So first is Phi Element points. So we discussed about 5 elements, right? What are those 5 elements? I don't know where I covered here. 1 second. Oh, I think this slide is missing here, I think. Okay. Maybe some mistake here. I think I missed some slides here, I think. Okay, I will add it from my other thing. So basically, there are 5 elements are there, right? So each of the element, so for example, like we discussed this also in the class, right? So we have Panchabhutas as per the Hindu tradition. As per the Chinese tradition, it is called 5 elements, right? And except for 2 elements, they're all exactly same, like fire, water, everything is same. So now these 5 elements, basically, they are interconnected to each other. Like we discussed, if you remember, wood. They have Chinese have structured it in such a super way that that it is very easy to remember. For example, from wood you get fire, right? From fire you get ash. So ash is like earth, like that. So they are given in a cycle order, right? So what does it mean is, it means that one particular thing is nourishing the other one, right? So these 5 points are related to in every channel there are one point related to each of these elements, 5 elements, right? That is what is called Phi Element point. And each of the element, if you I will just go back here 1 second. If you see each of the element, 1 second. So if you see in the organ clock theory, each of the channel and its connected organs are related to one element, right? So for example, stomach and spleen are earth, right? Heart and small intestine is fire. So bladder and kidney are water. Pericardium, triple armor, fire. Liver and gallbladder, wood. Lung and large intestine, metal. So what it means is that each and every organ is of certain element in nature, right? So for example, lung is a metal. Large intestine is a metal, which means that that represents the metal, right, of the Phi element. So now, so irrespective of what the channel, let's take lung as an example. Lung channel corresponds to lung organ, and the lung organ is a metal organ. But in spite of what type of element it is, that organ it is, each channel has one point that corresponds to Phi element point, right? So like fire, wood, fire, water, metal, water, like that. Okay, so that is Phi element point. Jingwell points means those are all the points that are connected on the extreme, which is like finger or toes, right? And the importance of this point is that it helps to treat any acute emergencies, like if you have shock, coma, or anything, it helps you to treat, right? And alarm points. We discussed about alarm points and Ashi points, right? These 2 points help you to do diagnosis. Diagnosis means not any any serious diagnosis, but yeah, we can understand now how see the diagnosis in Chinese medicine is not done using points. Okay, so the diagnosis in Chinese medicine is done using several different techniques. Pulse is the very important technique. Then they check your physical appearance, so many things, but these points help you to understand certain things. So for example, um, um, last 2 weeks I had severe this thing. I was traveling and I got maybe some infection, COVID, or I don't know what was it. So then I had severe lung infection. So here, if there is a point, I think we discussed also in the other one. So there is a point here that is between. If you want to see my photograph, you have to pin my photograph. Then only it will be visible bigger. So if you see here, this place where where my thumb is there. So this place in between there is a point here. So if this point is paining, it means you have some lung infection, right? So when you take care of this pain, and if the pain slowly goes away, it means that your lung has become regenerated, and you are slowly coming out of the lung infection. So similarly, there are many points are there. So you can just pin back the presentation again. Yeah, so these are the points. So alarm points, they become tender. Tender means like they become soft and paining and all, right? When there is an acute problem. So if you have acute disease, then these points. So that's why it is called alarm point, right? We discussed about acute problems, and also we discussed about chronic problems, right? Chronic problem doesn't kill anybody, whereas acute problem they kill. That is why they are named as alarm point. Whereas Ashi points are they're all along the body. It is not any specific point. It can be all along the body, and they become tender. Another important thing is they don't correspond to any channel, whereas alarm point corresponds to a particular channel. For example, every channel will have one alarm point. We will see all those things today. Then influential points. Influential points is like see, other than our organs, there are many other things like tissues, blood, tendon, these kind of bones and these things, right? So there are certain points which are helping you to certain what do you call treat certain disorders of this particular thing. So those are all called influential points. Then Yuan source points, this I think we discussed earlier also. So Yuan source point is a point on the 12, on the 12 channel near the wrist or ankle, right? And they help you to treat, any, diseases which are, chronic in nature, right? Or subacute. Subacute means like it is going to really become a problem in the future. And Z cleft point, this is for treating acute problems, right? These are all the different things that we discussed. Then the next thing what we discussed was do and run channel. So do and run channel are two additional channel. Like I told you, there are no extra channels, which are discussed in classical acupuncture. But in modern acupuncture, two important channels are considered: do channel and run channel. And these do and run channels are considered as part of the regular channels. So as per modern acupuncture, there are 14 channels, not 12 channels. So do channel, see, do channel and run channel, the importance is they are not connected to any organs, right? So unlike the other 12 channels are connected to one organ, they are not connected to any organ. And similarly, here also we have yang channel and yin channel. And no, Ren channel starts in the front, whereas the Du channel starts in the back. And why it is called Du channel is because it is actually a governing channel, right? It governs all other channels. So if this Du channel is perfect, then all other channels are working perfectly. Whereas Ren channel is connected to what do you call? No, Ren channel is also called. See, there's another thing I think I forgot to tell you that Du channel is called DU or GV. So because GV means governing vessel. So the old terminology was GV, but now it is called DU. Why it is called GV? Because it is governing channel. So similarly, Ren channel is also called CV because right, it is related to the reproductive functions, or it is a conception vessel, right? All the contraceptive those things, right? So it's from that actually. So this Ren channel is important for reproduction and reproductive related organs healthiness, whereas the Du channel helps to take care of the complete organs. So these are all the two channels we discussed, right? And in the app that I gave you, even Du channel, Ren channel is also there. You don't need to buy any separate subscription. It is available for free. Then we just got a little bit into detail, right? So what we discussed is about different types of Phi element points are there. So for example, like one is the Phi element points as such. Now in the Phi element points, there is something called horary point. So what is a horary point? Horary point is nothing but, see, in the organ clock we discussed about every 2 hour. Each of the organs get the energy. So if you have any organ related disorder, then you can choose those horary point and then treat them, so that at that point of time when you treat, like for example, if you have a lung problem, between 3 to 5, if you treat the horary point of lung, then what happens, your diseases will be healed very fast, right? That is called horary point. And what is the definition of horary point? Like take lung as an example. Lung is a metal, right? Which means that I think lungate is the horary point. I'm not sure. You can check later. So lung is a metal. So which means that in the lung channel there is one point which corresponds to metal, right? And that is horary point, right? So similarly, large intestine is also a metal. So which means there is one point in large intestine which corresponds to metal. So you have to take that point and then do massaging, or if you know acupuncture, you can put needle. So it is active only during that time. So that is why it is called horary point. Then mother point and sun point. So mother point and sun point helps to tonify or sedative. So this also we discussed. So mother point, see, the mother point, sun point is derived based on the Phi element theory, right? So what is the Phi element theory says? There are 5 elements are there, and each elements are connected to each other. So how are they connected to each other? The way they are connected to each other is that one is influencing another. Correct. We talked about the generative cycle or show Ken cycle. I think I missed the slide here. So we will discuss this more in detail in the next class. So I will not go through that now. So mother point and sun point are used for tonification, sedation, right? So that's what we discussed in the last class. Okay, so I think we almost revisited all the things that we discussed, except for that what do you call that, Gen show cycle and Ken cycle. We didn't discuss that Phi element theory. Maybe we are going to go through more in detail in the next class. So that time we will go through that. Okay, so I'll just pause here if you have any questions. Anybody has any question? Okay, so if nobody has any question, then what we'll do is, yeah, one more thing. I think this also I forgot to tell you that because it's going to take some time. See, we started on November, I think 21st November or something. So the plan was that we wanted to complete this in next 3 months, right? I think we already covered November, December, January. Almost 2 months is completed. We have one more month. I'm not sure if we can complete by February end. Probably by March end only, I think we'll be able to complete. But we don't want to wait till that time. So what I did is I gave you a sheet where It is posted in the Google Classroom as well as WhatsApp group. I had given you all the important points for all the common diseases, right? Like, what are the different types of diseases? It starts from chronic disease to acute problems. I given that. So you have the app, you have the PDF, posted in Google Classroom and WhatsApp. So what you can do is you can see, learning is one, but another important thing is you have to put in practice, right? If you keep on learning, there is no point, right? So the idea here is that you have to start practicing. So what you can do, first simple thing, like we discussed, the simple thing you can do is rotate your all your this thing, right? So you can rotate all the joints, including your head, your neck, everything. This itself will give you a very important health benefit. That is the first point we discussed, right? And second point we discussed about our lifestyle, right? How to keep our lifestyle. Like we just discussed in the organ theory that you have to do certain things during certain time, right? Eating lunch at eating dinner at 8 o'clock, 9 o'clock. These are all like you are destroying your body, because we have just seen the organ clock theory, right? 11 o'clock is the time where you are your organs need to right, the liver works at certain time, all these things, right? So the body needs to get some see, the energy is given for that for that organ, so it has to do the work. But if you eat that time, or if you eat very late, then what will happen, that energy will be used to do certain other activities. So then this replenishment won't happen. So see, you can try this out. Those who stop their those who go to bed 3 hours after the food, right? Next day morning when they get up, even if they get up at 5 o'clock or 4 o'clock in the morning, they will not have any tiredness. They'll be able to get up and work properly. But once you have your food, and immediately you sleep. Let's say you eat at 8 o'clock and then sleep at 10 o'clock, or if you are awake till 1 o'clock, like this, then what happens? Your body doesn't know. Your body doesn't know where to focus. Whether to focus on digestion or whether to focus on replenishment, right? Repairing all your cells, other things. So just remember this thing, that there is a time for everything, right? So you have to just make sure that you have to align your activities during that time. So this is the second thing you can do. The third thing is when you can do acupressure now, right? Acupressure, I told you, that is not going to be very powerful, but end of the class we will see other techniques also. I'm not going to teach you acupuncture because that is going to be illegal. So I'll teach you certain other techniques which are legal, which you can practice without any problem, right? So what you can do a massage. So when you do anti-clockwise, you are actually reducing the energy. When you do clockwise, you are actually increasing the energy, right? So normally what we should do, we should know when there is a problem. We should know why the problem is happening. Is it because of reduction in energy or increase in energy, stagnation in energy or excess energy, and which organ, and then which channel, and then what element, and then you have to do. So if you don't know that much, what you can do, I've given you the points, right? For every problem, you pick your problem, pick your points, then you try to, you try to do massage, like anti-clockwise and clockwise. Maybe 3 times, 4 times, you'll definitely see better improvement, right? So with this, we will now go to the next lesson. So in the next lesson, what I'm going to do is, I'm going to say, unfortunately, I actually, I won't say unfortunate, but I purposely I didn't put it in a table and give it to you, because if you do it by yourself, then it will be easy for you to remember. I think some of you are taking very excellent notes, so you can take a notes of this. So I hope all of you have a notepad. So what I'm going to do now, I'm going to talk about each and every channel. I'll give you the points, very, very important points. What points are there? You please make a note and then create a table. So the column of the table should be each and every organ, like lung, large intestine, like this. And the row can be different types of things, like we discussed about, like a Harari point, right? Zeke left point, these points, right? So you create a table and put these points after the lecture, after this class. And then from next week onwards, we are going to talk about different types of problems and other things. So if you prepare this table, it will be easy for you to follow. Okay. So I'm going to just give me 1 minute. I'll tell you all the points. You also please keep the note in front of you. Okay. So first we will start with the lung channel. Okay. Should I wait for one more minute, or all of you have? If anybody wants me to stop, please let me know. I'll wait for maybe a minute or so. Okay, so let me start. So first, let's start with lung channel. Uh, okay, so lung one, this is alarm point. Okay, lung one is alarm point. So what is alarm point? We already discussed, right? If there is a problem in lung, right? If you press here, you will get a pain, right? That is why it is called alarm point, right? Lung one is alarm point. Okay. Next one is lung 5. Lung 5 corresponds to water element. Okay. And who is the mother of water? Metal is the mother of water. Correct. And lung channel, lung is a metal. Correct. So this is also a sun point. Is this clear to all of you, or should I explain again? I'll explain again. See, lung is a metal, correct? Metal creates water, or metal nourishes water, right? That's what we have seen, correct? Imagine like you have ice which melts and then becomes water, something like that, right? So metal nourishes water. So, so metal is the mother, and sun is water, right? Since this point, that is Lu5 is water point, it is a sun point, right? Okay. Next is Lu6, that is a Z clef point. Okay. Okay, so what is Z clef point? Let me just go back here. I'll just leave it here. So Z clef point can use to treat acute problems. Like, so for example, you suddenly have an asthma attack or something, then you can actually, take Lu6. See, in the interest of time, I'm not going to talk about where these points are. So you better find out from the app itself, right? If you have any doubt, we can discuss in next class. But this is a very important point. It's actually, suppose somebody has any asthma attack or anything, you can immediately do Lu6 and then it will bring you some better recovery relief. Okay, so Lu7 is confluent point, loop connecting point. You can note down this. I think I didn't explain what is loop connecting point. I'll explain in the next class. See, loop connecting point, you can imagine like these points are connecting two different organs together. So we'll discuss that in the next, not organ, two different channels together. Okay. Then Lu8 is metal point, right? Lu8 is metal point. It corresponds to the metal. Then Lu9 is actually yuan source point, right? So Lu9 is your source point. So what is yuan source point? Your source point is in the wrist or ankle. So you can just see, Lu9 will be there in the joint. Okay. And Lu10 is the fire point, correct? And Lu11 is the wood point. And Lu11 is also jingle point, because where is Lu11 ends, right? Lu1 starts from here, it ends in the this thing, right? So Lu11 is the wood point. So you understand here, right? We have covered all the 5 points, right? That is, water point is Lu5. Then you have metal point is Lu8. You have fire point. You have earth point. We have wood point. All the 5 points we covered, right? Now here, which is the horary point? Can somebody tell me? Now let's see if you are able to understand the concept, right? So what is horary point here? I didn't tell what is horary point, but what could be the horary point? Anybody wants to give a try? Very simple, right? So lung is metal, right? So which point is metal here? That is the horary point, right?
Is it Lu8?
Yeah, correct. Lu8. Yeah, Lu8 is the horary point. So this is very important. So if you have a problem with related to lungs or anything like you have cough, this thing, or you have lung infection, especially during COVID times, you have this kind of problem. Between 3 to 5, you do massage. Sorry, not this Lu8. Okay. So Lu10 is this one. This is fire point, right? Okay. So this is all about lung channel, right? All of you noted down, right? Or should I repeat for anybody? Okay. See, one more thing you have understood now that we discussed about several points. Certain channels like lung, heart, pericardium, they have very minimal points. So you will see one point itself will will work like multiple functions, like same point. For example, if you see here, there are certain points that acted like double the thing, right? I'm not talking about elevate, because elevate anyway is only one point, right? And that's a horary point. So for example, like LU5, water point, sun point. Uh, for example, okay, here there is no such point. Yeah, maybe we'll not talk about that. You'll get confused. So next we'll go to LI, LI, that is large intestine. In large intestine, LI1 is the metal point. Okay. Okay, LI1 is metal point, LI2 is water point, and LI3 is wood point. Okay. And LI1 is also Jingwell point, right? See, what is the Jingwell point in lung? I think we didn't discuss about that, right? That is LU11. Because lung channel starts from here, ends in this thing. So that is Jingwell point. Whereas in LI, it starts from the forefinger, right? So LI1 is the Jingwell point. So LI1 is both Jingwell point as well as metal point, right? This is what I was trying to tell in the previous, this thing. Then LI4 is Yuan source point, right? Which means that that point has to be somewhere in the ankle or somewhere in the joint, right? And LI5 is the fire point. And the LU6 is the LI6 is the Lu connecting point. LI7 is the Z clef point. Okay. And LI11 is the earth point. Okay, so that's about large intestine. I think we have to move a bit faster. So stomach channel, we'll try to cover as much as possible. And the next class, I'll give you
Can
other
you
points.
please
We can't
repeat
cover.
what is LI7 and LI11?
LI7 is Z clef point.
Okay.
What is the other one? Sorry. Yeah, LI7
11
is Z clef point.
and 11.
No. LI7 is Z cleft.
Okay.
LI11 is earth point.
Okay.
Okay. Next is stomach. In stomach, we have many points, but I think we need to be very ST25. This is alarm point. Okay, we'll talk about that more in detail. ST25 is alarm point. ST34 is Z clef point. Okay, ST36 is very, very important. ST36 is earth point. Okay. Then ST40 is Lu connecting point. Then fire point is ST41. 42 is Yuan source point. And then what did I miss? Wood point. Yeah, ST43 is wood point. And ST44 is water point. And ST45 is metal point. Okay. Yeah, some of you are a bit confused on what I'm talking. If you have not attended my some of the lecture, we have the recordings. I think first 1 or 2 classes we missed the recording, but otherwise you have all the recording, so you can just go through and refresh. Okay. So I think we'll stop here for this 3 channel. For remaining channel, I will tell in the next class. Okay. So from the next class we will start talking about very important aspect. We'll try to finish maybe in some 3-4 classes. Okay, I think thanks everyone. This will stop here and I'll see you next week.
Thank you.
Thank you.
Yeah, thank you.
Thank you, Gomal.
Thank you.